Hey guys, it's Steve, and what we've done here is create a video for you to help you learn two of those National Registry skills that students often struggle with. That's your two big skills, your individual trauma scenario and your individual medical scenario. Now what our goal here was to give you an idea going into that skills station. What is the skills proctor looking for? What is that going to feel like? What's that going to sound like? Just a strong example of what kind of performance we'd like to see from you. Now, having said that, the performances you're about to see from myself and some of our former EMT students are not perfect. If you follow along on the National Registry sheet, hopefully you can pick out some of the errors that we make along the way while we're doing our scenarios, and I hope you'll do that. But mostly, I hope this will give you an idea of what a strong performance in the skills station looks like. I sure hope this video helps. Here we go. So let me start by giving you some general tips and tricks, and these apply to all of the stations that you do, but maybe some ways to help this go smoother, or some of the common tripping points that people run into while we see them doing these skills. First, I'm going to say, while you're learning these skills, learn them in order. Learn them in the order that's on the sheet. And I will be the first one to say that I know that order doesn't always make sense. That can be difficult to maintain that order. Your brain says, well, wait a minute, I know there's something else that should come first. I'm going to jump to that and then come back to this. But when you jump around in the skill, you try to jump forward and then come back, a couple things happen. One is your proctor needs to work harder, to work up and down the page to make sure, okay, now we're doing something that's actually a part of the secondary assessment. Let me go down there and do that. And okay, now we're back on airway. Now that's a circulation thing. Okay, now we'll go back to airway. Don't make your proctor work hard. When you do the things in the order that they are on the sheet, it's almost like saying there's a bit of confidence to it. It's like you're saying to your proctor, I know what your skill sheet looks like. I'm going to do it for you verbatim, right in order. It also, I think it helps you remember things if you just learn it in the same order and you keep that order all of the time. When folks start jumping ahead and then coming back, or making statements that are talking about what they're going to do in the future, such as, okay, I'm going to be treating this patient for shock in the future, or I'm going to want to transport this patient emergent, even though they're still managing the airway. When it actually comes time for them to treat for shock or or transport the patient emergently, they're oftentimes going to forget those things because in their mind they've sort of checked them off. So stay in order while you're doing the skill as much as you can. Second thing I would advise you is oxygen, transport, oxygen, transport, oxygen, transport. Those two elements fail most of the folks that fail their individual trauma and medical scenarios. It is either not putting the patient on a high concentration of oxygen, forgetting to transport emergent to the hospital, or doing it far too late in the skill. Those things tend to trip folks up. So on both of those points, something I would say is, even if the proctor says it's okay for you to not put the oxygen on the patient or near the patient, I would still give yourself some sort of visual clue with that oxygen that you were going to put on the patient that you've done it. So if you forget to do it, it won't look right to you if you practice that way. The other thing I'd say about transport is with both oxygen and transport, students are often going to ask us, should I always put them on an oxygen mask? Should I always transport them emergent? And I don't like that type of thinking that says, regardless of the scenario that I get, I am always going to do these things because that's the safest thing to do. Having said that, if you decide to put them on a nasal cannula instead of a mask, and if you decide to transport them non-emergent instead of emergent, have a very compelling reason why. Know for sure why you're doing that and have a very strong argument why you wanted to go with that lower acuity oxygen administration or slower transport. Because the patients we tend to give you in scenarios tend to be sick. more often than not, we're giving you a patient that will need high flow oxygen administration and emergent transport to the hospital. The next thing that definitely trips people up is their medication administration and dosing and that medication in that medical skill. You really need to know your indications and your contraindications for your medications. You need to know them well. Now, hopefully, if you've done the scenario in order, you will have gone through all of the things that you need to do to know for certain that that medication is indicated and that there are no contraindications. So that means you've asked about their medical history, the medications that they're taking, whether or not they have allergies. You've taken a full set of vital signs. It's not only important to know that they're indicated for the medicine, but it's also important to know that none of those contraindications, those reasons why we cannot give a medicine, it's important to know that none of those things are present as well. So know your medications, your doses, your routes, your rates, when they're indicated and what their contraindications are, and you're going to do great at that portion. A last piece of advice I'd give you is finish strong. Finish strong. I think when folks practice these skills, they start at the beginning of the skill, they go through to about halfway, and if they feel like they're messing something up, they stop and they start over at the beginning. And by the time they've been practicing these skills for weeks and maybe even a couple months, they're really good at the beginning part, but the ending part is the part where they tend to struggle with. It's okay to practice the skill in chunks. I'm going to practice the first half. Now I'm going to start with the sample history, and now I'm going to just do my secondary exam and break it up. Those skills that come towards the end of the skill, whether it's a detailed secondary assessment, vital signs, calling the doctor, it's important to practice those things as well so that as you're doing the scenario, you can have a good, strong finish. Before we leave, actually, a couple rules of the station that I wanted to point out to you. One of them are you can play with the equipment that they give you when you go into a station. You're going to notice when you watch these trauma skills that the stuff in the bag, when we're grabbing stuff out of our bag, we know exactly where it is. It's all ready and prepped, and we've thought ahead of time, in case I get a sucking chest wound or an evisceration, here's where my equipment is. As you walk into the station, ask your proctor, is it okay if I open up this bag and go through it and make sure I know where everything is? If it's an airway station, make sure you position your equipment exactly where you want it. You have every right to set up that station before you begin. And another thing I'd point out is in the skill stations that we're going to do, you're going to see us writing some things down on pieces of paper. Perfectly appropriate, as long as that paper is blank at the beginning of the skill station. Once the skill has begun and the clock is running, you can write anything on that piece of paper that you want. So you're welcome to take notes. I want to give you a couple of tips or maybe tools that we like to tell students to help them memorize and learn a physical skill like this. I think there's a couple things, 3 things in particular that students have used in the past successfully to learn how to do this. I think it's important to remember that this is a performance, really. A skills station is a performance. You're on stage, so to speak, with an audience of 1 who is your skills proctor. And when you're learning this performance, these things might help you out. The first one is called boxing. What we do with boxing, or sometimes folks will call it chunking, is we take the information, a large amount of information that seems like it might be a little overwhelming to us, and we break it up into learnable chunks. And a lot of these National Registry skills can very easily be divided up into chunks for you to learn. It's really a format that lends itself to that chunking or that boxing of information. With the beginning of either one of these skills, you can take your initial arriving on scene and make that into a chunk or a box to learn and just practice that part of it. Practicing, I'm wearing my BSI, the scene appears to be safe, it looks like I have 1 patient, I'm going to call for ALS, I'm going to go ahead and consider C-spine, the patient's chief complaint is, or my impression is. Learn that as a box and then move on to your patient's level of consciousness or your airway box and learn them in those boxes and then put them all together. That also helps you with that advice that I gave you about finishing strong. You can take the end of the skill and box those up into learnable chunks, and then make sure that you're practicing the end of the skill as much as you're practicing the beginning of this skill. The second one is what I would call monologuing. And what monologuing is letting go of the whole physical skill itself and just practicing the narrative. The nice thing about monologuing is that you can practice monologuing anywhere. And actually, our brain is very adaptable to learning stories. It's easy for us to learn things in a story format. And when you monologue, you create in your head basically the story of the scenario. And you can do this while you're driving your car down the road and nobody else is with you. You can drive your car down the road and say, now I'd like to check this patient's airway. I'm going to see if his airway is open. I'm going to see if he needs any airway adjuncts. I'd like to go ahead and check his ventilatory status, and say those things out loud and learn that narrative. Once you've learned that narrative, you'd be surprised how easy it is to integrate the physical skills. Often it's the narrative that people struggle with most. So learn some monologues and just have some fun practicing monologuing and getting it to line up exactly with the skill as you can. The third one I'll say is what I would call encoding. The more you can take the information in the skill, that large piece of information that seems overwhelming, and create your own sort of code for remembering it, the better off you're going to be at remembering those critical details. You've already learned encoding when you learn your acronyms. Acronyms in medicine are so widely used because they're a very effective way of encoding. When we taught you how to do an OPQRST assessment or a sample history, we were just teaching you a way to encode that information. When we came in here into the studio today to do these practices, for us, we haven't done these skills in at least a year, and for some of the students showing up, they hadn't done these skills in 4 or 5 years. The way we tried to relearn these skills in a short enough period of time as possible was we took some billboards and we encoded the information. We created our own code for the entire skill, start to finish, that we could look at and would help us remember that skill. So those are 3 pieces of advice. You can always try to box and chunk up that information, monologue it as much as you can, and encode the information into a format that makes sense to your brain. I hope that helps.